How hyperinsulinemia causes increase in food intake. The more the insulin levels are in the body, this is because the sudden rush of the high GA index foods we get take blood glucose, the food enters into the bloodstream very quickly and pushes the blood glucose to a higher level. This precipitates the pancreas to produce more insulin. Because of that, there will be insulin sensitivity will be lost and insulin resistance happen. Important point about insulin resistance is post-receptor signaling is lost, so pancreas produces more insulin. These high insulin levels, what do? Again, they make it a loop that they make to brain gut axis is altered, and they feel like taking again and again the food. This is called as a carbohydrate trap. So the people who are having high insulin and with the abdominal obesity, central obesity, these people with are having either insulin syndrome X or metabolic syndrome X, they have the chance of eating again and again are very high. Even if they think of food, the insulin levels start rising, and they appreciate more the food, especially in female. The estrogen hormone makes the brain and enjoy the flavors of the sweetness. So women are more prone to eat something food which is nearer to the sweet, and the failure rate of maintaining a fasting or diet pattern after 1 year are very high, because the insulin and the brain, they are more, brain became insulin resistant, and so there will be lot of production of insulin, and this produces hyperinsulinemia. Hyperinsulinemia triggers obesity. How it will do? Because of free fatty acid release. Insulin has a very important two roles. One is lipogenesis, second is anti-lipolytic. At the level of the adipose tissue, it prevents the adipose tissue to break down. Because of this, there will be increase in the adipose tissue, and at the hepatic level, it causes increase in the triglyceride synthesis, and there will be more amount of fat deposits in the liver. Most important is there will be release of the free fatty acid. Because of this release of the free fatty acid, from the adipose tissue, they go into the liver or go into the muscle. They make that specific organ insulin resistant. Because of that, the energy that we eat, the glucose that comes into the system will not enter the cell, and the cells will be hunger, but the blood glucose levels will be high and insulin levels will be high. So this is post-receptor failure. Similarly, we will be seeing this with leptin. Leptin is nothing but making it thin. The post-leptin receptor resistance will be there. These, when the brain